Well, it was a beautiful, calm morning on the lake, and right after breakfast, Alicia and her cousin wanted to go out on our jet skis. And I think that Alicia was trying to make a wake for Amanda to come and jump over with the other jet ski.
My jet ski went under, and hers went over and flying, and I went underwater.
They decided to then life flight her here to St. Pat's.
You don't have to be doing anything wrong to be a trauma patient. Sometimes it's just a matter of being in the wrong place at the wrong time.
St. Patrick's is the regional trauma center for Western Montana. Our hospital takes care of the most critically injured patients in this area.
We've really reached a tipping point where we need to grow here within the hospital in order to provide quality health care.
What's unique about a level 2 center over anything else is the level of preparedness 24 hours a day, 7 days a week.
All the subspecialties that are critical to care of a traumatic patient have to be available to us immediately. Our current emergency department was built in the mid-1980s and was to accommodate about 10,000 visits per year. We're well over 20,000 at this point.
As our population continues to increase here in Western Montana, our trauma volumes will continue to increase.
There's real changes in the population in Western Montana. The age cohort over 65 is growing faster than any other age, and we need to be prepared to take care of the problems of people 65 and over. At the same time, 10% of our patients, over 2,000 of our patients, are children. The #1 killer of children is traumatic injury.
The emergency department is really the front door of the hospital. Over 60% of the patients that come through our doors come through the emergency department.
When this department was designed in the early 80s, emergency medicine was entirely different than what it is now. And the current design does not accommodate the changing needs of the patients that we take care of.
They're cramped, they're very busy. They have enormous pressure, and they're trying to make 20, 25-year-old space work in a world that's much changed since it was 25 years ago.
Having an expansion in the emergency department would really help us be able to treat patients more timely, to be able to accommodate all the different patients that come in and provide a safe and private environment.
The new emergency department will over double in size, and what that does is it gives us an opportunity to significantly enhance the care processes, provides enhanced patient safety and security and privacy, and it also gives the staff the resources and the space to do their jobs more effectively.
Being able to build trauma rooms that have more room for CAT scans and x-rays and people to work and better technologies so that we can see the results of those diagnostics will really benefit our patients.
The emergency department expansion project is roughly a $15 million project, and it's going to be funded through a mix of funds coming from operations from the hospital as well as through donors in our service area.
St. Patrick Hospital Foundation is asking the community to help us out in investing in the community, investing in our emergency department, trauma care, cardiac care, stroke care. Every single day we provide charity, starting at the emergency department.
St. Patrick Hospital and Health Sciences Center has been a not-for-profit organization since its inception in 1873. We have to go outside to our communities and solicit help from our communities in order for us to continue to be able to function effectively in fulfilling our mission.
The hospital chose the emergency department rebuild as its first capital project in almost 30 years because it really touches everybody in the entire area of Western Montana.
This capital campaign is a chance for the community to recognize really the value of what a great human institution brings to a community. Helping build this facility to take care of the future is a fantastic investment of time, money, and a little bit of spirit.
Well, we're very fortunate to have our children and our grandchildren, and in fact even our great-grandchildren living in Missoula now. And we want to have this facility there for them if they need it.
It's those moments where you make choices about how you engage in your community that matter over time. The folks at St. Pat's relentlessly make that commitment to community, and that is what endures.
It's an interesting kind of place in your heart that people take and will always be there when they have so significantly cared for your child. And I don't know how to say thank you the way that I want to.
There's a pretty good chance that in your lifetime, you, someone that you know, someone that you love, will end up in a hospital because of trauma.
It's the last place you want to be, but if you're there, it's the best place to be. And that can only get better with the enhancements to this department.
I think each of us has to sort of make a decision as to what to support, where you can put your money, and what are your priorities in your community. But as I've become involved in this, I think that as a priority, it has gone up in my list. And it is because of my realization that it is such an absolutely necessary part of our lives.
The reason that we can do this work is that we have, at times, spectacular successes. And sometimes some pretty miraculous things happen.
I think that whenever you can invest in other people's lives, it's a worthwhile investment.